Hello again, everybody. Today is September 22nd. Welcome into another Keep Boone Healthy Community Information Channel Vaccine and Community Health Update. I'm David Jackson, President and CEO of the Boone Area Chamber of Commerce. With us, as always, our good friend Jennifer Greene, Director of Public Health and the CEO for AppHealthCare, and Sean Burroughs, the Director of Pharmacy for Appalachian Regional Healthcare System. It has been a while since we've gotten the trio back together again. So, Jenna, I'll give you the opportunity to kind of give us the first statement here of just where things are from a community health standpoint right now. I know that you continue to put a lot of numbers out of your office, and we've heard from the governor this week, Dr. Mandy Cohen this week. We see the reports that you put out on a weekly basis. How is the community faring at this point with all things related to COVID?
David, I'll just say we're still in an area of high transmission. I have some positive news, though. It looks like just over the last week, we're starting to level a little bit. I'm cautiously optimistic. I think folks need to remember when we were in December and January, when we had high levels of COVID transmission, we're still in those high levels right now. So we're certainly not out of the woods, and we've got to do more to try to help prevent the spread of COVID by getting more people vaccinated. And I think that's what we're going to talk about today.
A lot of conversation around vaccination, and something that I think would be helpful maybe for people to get a grip on is where things are in approval processes and what that means for booster shots. Those are terms that are being thrown around and concepts being thrown around a lot right now. Sean, maybe you want to take the first, no pun intended, first shot at this to see exactly where things are here in the high country and what people can expect from that standpoint.
So booster approval is close. The CDC committee met today for Pfizer's vaccine. And the last that I read, they actually will vote on Pfizer tomorrow and help give some more guidance on who exactly will be eligible to receive the Pfizer booster vaccine, possibly as early as the end of this week or early next week. It looks as though it will be patients or people that are 65 and older, possibly healthcare workers as well. And there's a third category that I think the committee is trying to work through right now, are those that are at really high risk for severe disease. And so that's really the guidance that we are waiting for to hear. And I think the plan is tomorrow for the CDC to vote on that. So hopefully we'll have some more information as early as tomorrow afternoon about who will be eligible for the Pfizer vaccine booster. The Moderna and Johnson & Johnson still are submitting their data to FDA. There hasn't been a date that I'm aware of set for the FDA to meet about Moderna's booster vaccine information, or Johnson & Johnson for that matter. It seems both of them have good data to present to the FDA, but when exactly that's going to happen is still to be determined. It might be a week or two. It could be a little bit longer than that. But booster doses are coming, beginning with Pfizer's, possibly as early as the end of this week.
You know, and you may both be able to elaborate on this point. You know, yesterday in the governor's press conference, we heard a reporter ask, just because I'm eligible for a booster, does that mean I need one? Is there guidance coming along those lines as well? I know you mentioned categories specifically. That kind of takes us back to how this all rolled out in the first place. But are there certain criteria that you are seeing from these companies that are prioritizing who and when these boosters should be administered, or if they need to be administered at all based on someone's individual circumstance?
Yeah, that's a very challenging question that's been hotly debated over the past few weeks. The World Health Organization has a different opinion than what the FDA is looking at right now. I can simplify it this way in my perspective from being in the hospital, is that if folks feel they're high risk for developing severe disease and the booster is available, and they want to protect themselves and their family, I totally understand getting the booster. I think anybody that wants it and feels like it would be helpful for them and to protect them and their family, absolutely. From the hospital standpoint, I really want to make sure that we don't lose focus on folks that have not been vaccinated. Where there's a lot of talk right now about boosters and who should get them and who shouldn't and when it's going to be available. From the hospital standpoint, we're still struggling with watching unvaccinated people die. We've had 61 deaths in the hospital. 57 of those deaths have been in unvaccinated people. So I know there's lots of different opinions on vaccines, but that doesn't, if that doesn't grab you, I don't know what will, right? So 95% of the deaths, 90 to 95% of the deaths that we're seeing in the hospital are from those that have not been vaccinated. So I want to make sure that, as the booster discussion takes place, we don't lose sight of, if you haven't been vaccinated yet, that's the highest risk population of getting severe COVID and dying right now. And so if you're on the fence about that, I hope that maybe that information will help you lean towards getting vaccinated.
Jen, I know the last time we talked about boosters and booster deployment, the message was we're working on a plan. Once we get to that point, we'll have a plan that is easily digestible by the community and kind of gets us back into that kind of operational norm that we experienced back during the first vaccine rollout in terms of where to go, when to go, how to go. Now that we're getting a little bit closer to that deployment, is there anything that you can share with us about how people should expect to be contacted or just put themselves into the category of wanting one and being able to get one?
I think that all of us as vaccine providers are going to be working together to make it as easy as possible for folks to know where they can get a vaccine. Just because you came to one location to get a vaccine early on doesn't mean you have to go there to get a booster shot. You can go to any vaccine provider. So we are really pulling together, all of us, who is going to be providing vaccines so that the community can know, you can go to a bigger clinic, but you don't have to. Perhaps you want to go to a pharmacy down the road. And we know that we've had our partner Boone Drug folks on here before too. And so I think there's a strategic effort for us to make sure we get folks who might be in a higher volume category, say older adults who might be more interested in getting a booster vaccine. We want to give those opportunities, but we're waiting for more guidance. We want to get this clinical guidance clear before we announce more plans that we have in place. But know that right now, Sean's right. Our biggest goal is just getting people who are not vaccinated. So that's, if you're someone who's eager to get a booster shot and you have a family member or a friend who hasn't been vaccinated, I hope that you will take the opportunity to help hear their concerns and point them to some credible resources, because that's who we have the greatest concern about right now, are people who are not vaccinated.
Follow up on the booster conversation. We've heard a few people ask this question here locally over the last few days about mixing and matching, right? So they hear that one particular manufacturer has a booster available, but they received one of the other shots. Is it right, or is it allowable at this point in time to see somebody that may have gotten a J&J shot back in the spring looking for a Pfizer booster now? Or is that still not right to go to the Ghostbusters terms here and not want to cross the streams?
Oh, that's a good reference. So there isn't data, really, a lot of data or enough data to suggest that that's what someone should do. And the guidance right now says you should stay with the same lineage. So if you got Moderna, get Moderna. If you got Pfizer, get Pfizer. That's not to say that it wouldn't work, but it's also, there's not enough information out there to say that it would. If you think about Pfizer, you had to get 2 shots in your initiating phase, right? You had to get 1 shot and then another one 3 weeks apart. Same thing with Moderna. You had to get 2 shots, kind of to build up your immune system. And now we're talking about a 1-shot booster. But if you switch from Moderna to Pfizer, the question, I guess, out there is, do you need 1 shot or would you need 2 shots of the Pfizer? Clinically, you would think 1 would be okay. But at this point in time, there's just not enough data to be able to recommend that confidently. And so they still recommend going with the same lineage. Now, they do say if for 3rd shots for the immunocompromised, if you were unable to get a 3rd shot of the same Moderna or Pfizer that you got initially, and that wasn't available, you could potentially go to the other side. But for booster, I haven't heard that conversation happening. So right now, the recommendation is to stick with Moderna if you got Moderna, stick with Pfizer if you got Pfizer, and then stick with Johnson & Johnson when that comes out if you got that first.
You know, along those lines, people have been seeking, as we all tend to want to do, seeking the alternative options. What can I do to increase my chances of not getting sick? So that's led people down a variety of different directions, whether it's seeking alternative treatments, whether it's seeking the next thing they see on Facebook that looks like something that can go out in the store and buy and take, and that's going to keep them from getting COVID. There's a lot of misinformation out there. Can you set some of that record straight on what treatment options are available here in the high country and what people should stay away from maybe at this point in time as well, in terms of that thing that looks like the next great thing that might be less than genuine in its presentation on the internet?
Jen, do you want to start with the release that you guys had last night, I believe?
Yeah, so we put out a warning about ivermectin. We know there's been we understand people are really eager to have an answer and a quick fix, but ivermectin has not been proven to treat COVID-19. And so I think it's really important to know that though you may be able to purchase it readily, it's not been proven and in fact can be dangerous. And so we're really seeing across the state, they've seen an increase in calls to the North Carolina Poison Control Center and people who are having some really rough side effects. And so we just want folks to know that's not to put in your toolbox. Should we see more information later about it, I think we will certainly be transparent in sharing that. But right now, we don't have anything that would tell us that's an effective treatment. And so we're warning folks against that because we know folks have been hurt by taking those medications when they really are not intended to use for COVID. And then I think Sean may want to talk about monoclonal antibodies a little bit.
Yeah, so first I'll follow up on the ivermectin use. There are clinical trials right now out there to determine if ivermectin is effective in specific doses and specific dosing regimens. So if there is a prescriber or a patient that truly was interested in that, there are clinical trials, even relatively locally. I think Wake Forest and Duke might be participating in one from what I heard today. But please don't take the ivermectin that's found in like the animal heartworm pills. That's not the same. That dose is different. The ingredients in that are different, and that could cause some serious issues. So that's something you certainly want to stay away from. Another option that has received a lot of press from federal and state is monoclonal antibody therapy. So if somebody has tested positive for COVID and within the last 10 days, they can receive monoclonal antibody therapy. There's been a big push on that, which often strains the supply. So whereas a few weeks ago, we were able to get as much as we needed and we're able to infuse, that supply chain has been tightened up somewhat. And so we receive an allocation at 75% of what we're ordering. So it's maybe not as readily available as it was a few weeks ago. And I want to stress that it's not a cure. I know that everybody's, I shouldn't say that way. I know that there has been a lot of press saying how good monoclonal antibody therapy is and it can prevent deaths and hospitalizations. It can. The data showed that it takes about 17 folks to get the infusion to prevent one hospitalization. And it's not a definitive cure. We have had people that have received monoclonal antibody therapy in the state that have ended up dying of COVID. So it's not like if you get monoclonal antibody therapy, you're good so that you don't have to get the shot. The best treatment is prevention, still is. And if you can prevent the hospitalization and death by getting vaccinated, and I gave you those numbers before about the 95% of the deaths that we've seen were in unvaccinated folks, that's your best option right now to help fight this disease. It has been from the beginning and it still is now.
Jen, I know that there's been a lot of conversation locally about some of the large scale events that we've seen. I know that there are businesses in town that are still wrestling with staffing and understanding that sometimes they have people that are exposed and they go through protocols, and that limits productivity in some ways. Can you speak to any local trends that you see in particular populations, or just some of the byproduct of those events? Do we know enough about those things yet to determine whether or not that leveling that you were talking about as maybe one of the positives is something that we can truly latch onto now, or is there more adjustment in those local metrics to come?
I think time's going to tell, David. And I will say, just like we saw before with our big peak of cases that we saw in the first wave, most of those cases were among 18 to 24-year-olds. And so that trend has held true again this time. And we're thankful to the university for the at least, having some testing opportunities available and encouraging mask wearing. I mean, those are some very important prevention measures. And I just wanted to say, that's, if you look at our weekly report, it's on our website. We've broken it down each week by age group, so you can see where we're seeing the majority of cases. And really that allows us to see where we're seeing trends. So are we seeing it that's driven from certain things? I don't think we can say that at this point. I think what we can say is that, just like before, we can see it's pretty broad spread. And the people who are having more severe illness and hospitalization are those who are not vaccinated. So that's probably the big takeaway, I would say, right now, David. And we're still watching to be hopeful and optimistic that we're going to see that leveling trend continue or decrease, hopefully.
I'll ask one final question to both of you, and this centers around kind of how we're all doing, right? I think, Sean, you may have mentioned earlier that we have seen heightened levels of frustration. People want this to be over. We all want to go down the road the way we used to go down the road, right? But this has been a process that's been building for a couple of years now. How are you both seeing the mental health presentation of all of this right now, and what advice might you have for people that are stressed about being stressed and have had to get into some of these contingency plan lifestyles for the better part of the last 18 months and are tired right now? What would both of you have to say in terms of resources and maybe some things that they can look out for and maybe utilize as we continue to go forward with this?
You can start, Jen.
Well, I'll just say we're seeing a lot of folks who are frustrated, tired, and I think emotions are high because we're all wanting to get back to normal, and we're sort of grieving that normalcy that we miss. And I think, among those are the folks who have been working in this for a long time too. They're dealing with it on a professional level, but also on a personal level too. And so it's incredibly challenging. I would just say it's likely that many folks are dealing with burnout right now, and we want to acknowledge that and normalize the fact that, hey, if you need help, now's the time to be seeking that help. Don't wait. There is a Hope for Healers line for healthcare professionals. There's also a help for North Carolina that's on our DHHS website. And I believe we have a link to our resource on our website too at AppHealthCare.com. We also have some great providers here locally. I think all of us acknowledging where we are and calling it out is really important, because we are tired, and we do see that folks are getting more, there's a lot more emotions that we're seeing, stronger emotions, because everyone's tired of this. But the tool that we have to help us get to a better place is to get more people vaccinated. That's how we get out of this pandemic. It is the path to get us there. It's to get more people vaccinated. So if that's one thing that helps you have something to do, I think that's it. And then the other thing I'll mention, the Watauga Compassionate Communities Initiative, they have a lot of great resiliency resources on their website. And I really encourage folks to go there and look at it, because, if you just need something really quick, that's a good tool. If you're a business owner and you just need something to help promote mental wellness, that's at least another resource you could use.
Great point. Thanks for sharing that. And we'll put that in the information, the podcast information as well, so people have a link to that resource. Sean, anything you want to add in that regard? What you're seeing at the hospital? Any thoughts on this?
Yeah, you hear about things, whatever it is, and I'm guilty of it as well. People tell me things, but I just can't relate. I wish everybody could come spend a few hours in the hospital. It would just give you a completely different perspective of what's happening, what families are going through when they have loved ones admitted in the hospital and can't be here because of visitation policies. It's heartbreaking, and the staff, the majority of the staff here are tired, they're emotional, they're exhausted. It's you can't understand it unless you're in this silo, and it's very difficult. People are grumpy, people are edgy, and I imagine that's that way pretty much everywhere, but specifically in the hospital. So it's just hard, and I would love to paint a rosy picture, but as Jen said, we've got a lot of work to do to get through this, to get to the other side. So my recommendation would be, obviously, one, I'm a vaccine proponent. I think that's where we need to go to help us get through this quicker. But two, try to find things that you love to do and do them. I think we've all learned a little bit on how to live in our current condition and situation. You can still go do some of the things that maybe last year we weren't allowed to do or didn't think that we could, but you just have to do them creatively. You have to be a little bit smarter. You can go attend certain functions, but just be smart about it. If you don't feel well and you're sick, oh my gosh, please don't go, because that's really how everything's spreading out. So just, if you're considering it, then please, look at the information, use what we've said today to get vaccinated, but also find things that you like to do, go on hikes, go to different functions, but just do it wisely. And I think that will help limit the spread as well.
Well said by both of you. And I would echo, one of the things that we, when we started this whole Keep Boone Healthy campaign back 18 months ago, one of those tenets was treat our community like you would treat your own, speaking specifically to guests. I think we could amend that and say, treat your frontline service worker like you would treat your family, whether that is somebody working in a healthcare setting, your child's teacher or educator, the person that's serving you coffee in the coffee shop right now. We have seen a rise in, I'll call it angst about all of this. COVID angst is a thing. And a lot of the folks that are in these positions that we're talking about are not the decision makers. They're not policy makers. It's not their idea to limit us in any kind of activity whatsoever. They would rather not be doing it either. So taking your aggression and your frustration out on those folks is just simply not making the problem any better. So treat your frontline service worker like you would treat your family. And I know that we can all get through this with a little bit more positive feel about it, and hopefully with more positive results soon. So thanks to Jen and Sean, as always. I know we'll talk to you again, and appreciate all you're doing to keep our community informed about these very important things that we're dealing with here as we get ready to head into the fall.
And David, let me clarify. Maybe it's just me that's tired and grumpy. I don't want to speak for everybody in the hospital.
No.
Listen, the frontline staff that we have they're emotionally exhausted because of the compassion that they're showing to the patients and the staff. It's me that's grumpy and frustrated that, man, I thought we were going to get through this, and I wish that we could get through it quicker. So I just want to make sure.
I think we're all there. And while we're just adding a last comment, David, I want to give a shout out to our school nurses. Our schools and our school nurses and leaders, they do not get enough credit for their help in the pandemic. And I think they are just heroic, and they've worked so hard, and just really appreciate all that they're doing. They've been lockstep with us the whole time, and I think deserve an immense amount of credit for what we've been able to do in this community. So just want to give a shout out to the school nurses. I feel like they deserve it.
Well, thank you very much for thankful Jen and grumpy Sean. I'm just the guy with the beard. We'll talk to you again soon.
Thanks, David.